Thank you very much. Now, I think my title on the sheet was Smart Technologies for Healthy Longevity. I have changed the topic a little bit, just in terms of the intersection of new technologies and public policy in an ageing society. And I really want to argue that there is a disconnect. Now, I know I'm speaking to the converted here, because as Philip Gillingham said before, I didn't realise we were in a very special stream, but it's a brave new world out there, and I've really appreciated coming to this session. These people are all people who have talked to us about the emergence of the network society, and I was on table at the University of Michigan and heard Bruno Latour talk about how person-machine relationships were going to transform our life. Well, I didn't realise at the time how prophetic it actually was. And we've had a lot of impact in terms of new health systems. Now, I'm not going to use that slide, but technology is both new, but it is part of the everyday, and I think particularly older people don't realise how much it is a part of their everyday. That's from a Norway report looking at new technologies. I just thought it was a lovely looking man sort of enjoying his technology. We all realise we're in a time of accelerated development, and if you look at the last period of time, you just see the extent to which technological developments have sort of multiplied. And my father was born in 901, and when I think back of the things he's seen change in the world, it's phenomenal. But what's going to change in the next 20 to 50 years? Now, Carl Chernus wrote this report looking at technology in an ageing society and said we're in the midst of two striking trends: widespread population ageing and rapid diffusion. And both phenomena are very new in human history. And he goes on to talk about how long it took for different types of things like the facsimile machine, the microwave, to be utilised as new technologies. So advances in both ageing and new technologies are a part of byproduct of population-level wealth accumulation and its reciprocal relation to knowledge, particularly scientific knowledge. That is, societies that have sufficient resources, and I'm very much aware that we're talking about developed and developing countries here, to safeguard the basic needs of their populations, can afford to invest in the pursuit of knowledge, and that pursuit usually leads to high returns on investment in the form of better knowledge and greater resource generation. This virtuous circle promises to accelerate the two trends of longevity and technology diffusion. Now, this morning Irene Hoskins ran us through the ageing revolution, and I'm just going to very briefly go through these next three slides. But in 1901, the average life expectancy was 47. By 2025, it's risen to over 80 years, and by 2050, a quarter of the population will be over 65. By 2050, 5% of the population will be over 85. And these are some geo-labour slides looking at 2000 and 2050 in terms of the percentage of the world population over 65. And those regions and countries comparing 2008 to 2040. And you can see the extensive difference, particularly in Eastern Europe and Western Europe. And the oldest countries in the world, are they necessarily the ones most technologically advanced? We heard a very passionate paper from Greece yesterday, and it's fourth on that list in terms of its ageing. How ready is Greece for the technological revolution? So half the babies that are born today, Professor Christensen from Denmark tells us, will live to be 100. And I won't go on about that, but these figures are now very significant and are focusing the minds of many people. So what are the drivers of change in the uptake of new technology? Usually in an ageing conference, one has to put an argument to be convincing. I probably think this audience doesn't need any convincing. So along with ageing, the increasing disability, increasing cost of health and social care, workforce shortages, the need to search out new ways of doing things, the concern to maximise opportunity for independence as well as interconnectivity, the need to support professional and family caregivers, to improve quality of care and quality of life, the trend to self-management of chronic disease, to meet the demand for more personalised medicine, and to increase service efficiency. And all of those have been extolled in presentations here. Now, it's argued that the new aged in the developmental world will put some demands upon us. By 2035, there will be twice as many people over the age of 80. And new elders, many of them, will have better financial resources and higher levels of education than before. They will possess large purchasing power and outspoken demands as consumers and as patients. The elders of the future will be active, mobile and self-reliant. With the ageing population, the need for health and care services will increase. More people will be living with complex chronic conditions, and group of dementia patients will double by 2035. By 2050, 3 times as many new full-time employees within the care services will be needed. It will be nearly impossible to meet the future needs of care services within today's system. We need to rethink society's supply of care services. So what's the potential of new technologies? We've heard the up and the downside even here today in the last 2 sessions. Products and services based on new technologies such as ICT are developing rapidly and are used by large parts of the population, also by elderly people, but in many countries lagging behind, particularly that age group. Increasingly, people between the ages of 55 and 74 are adapting to use of the internet, although we just heard from Hong Kong which groups are not. In Norway, for instance, women above 55 are the most frequent users of new technology, as indicated by a new report. Now, that's not the case in many countries. For many, it will be possible to prolong the period of living at home and at the same time feel safe. Monitoring and treatment of chronic diseases can be a higher quality and more continuous, and rehabilitation can be done from home. And I was very interested in the Hong Kong presentation on rehabilitation. Necessary healthcare can also be given outside the home while people travel. Tracking technologies can give people with dementia security and freedom. We just had someone in New South Wales drive from New South Wales to Melbourne, someone with dementia, and their wife didn't know where they were. So the utilisation of GPS technologies to assist carers is being looked at by our Alzheimer's Society. The internet can support and strengthen the elders' possibility to take part, communicate with the healthcare system and access social arenas, and examples have been given here. Technologies such as the smart house or tracking solutions can relieve the pressure on caregivers and support their caring work. Administrative technology can aid health personnel in doing a more focused job where more time can be dedicated to direct contact with patients and to health-related tasks, and we've seen several examples of that. Now, my concern really in this paper is how do all these technological developments fit with current policies in aged care? And my argument is that we are still, particularly in Australia, in a situation of cultural lag. We have no national position paper in relation to technology and ageing society. Now, these are the current articulated policies around the world: ageing in place, active ageing, social inclusion, social engagement and empowerment, and a few others: universal, transgenerational design. I don't know what the new words are for this at the moment. So how do they fit with policies in relation to technology development, and are they connected? A definition of technology, a bit old hat to this audience, I think. Now, again, I feel I'm absolutely preaching to the converted here, but for an ageing audience in Australia, it's important to try and spell out what are all the major areas of innovation that are going to affect an ageing population. And the next section of slides really gives a simple first level, first generation perhaps, definition of what are each of these areas, but they are all being developed currently in Australia, and I'm sure in Hong Kong and all these techno-savvy countries that we have in this seminar. Each of these slides gives a brief definition of what telemedicine is about, using telecommunication technology to deliver health services, and we had a very sophisticated presentation about the degree of interconnectivity. I won't elaborate more there. Assistive technologies, perhaps the most common and oldest form of technology, those pieces of equipment and products and services which can be acquired commercially and off the shelf and modified or customised, that is used to increase, maintain or improve functional capabilities of individuals with disabilities. And the top 5 are pretty old-fashioned: eyeglasses, canes, wheelchairs, walkers and phones. But maybe those iPhones are the future, and GPS. Robotics. I don't know whether you've got your own named robots in Hong Kong, but on a recent visit to China and north in Shandong, and also to Paris, we went to several robotic development labs, which was very interesting. So although computerised robots have revolutionised industry and medicine, the effects on the lives of the average citizens have not been as telling. The myth of the robot that does the house cleaning and prepares the meals has been perpetuated for some 30 years. We do see a few coming out of Japan. Increasingly, however, no essential human function, physical or mental, will lack an artificial counterpart. Some of this is already manifest in the utilisation of artificial organs and other body parts, often superior to the original. The smart house, the home or working environment which includes the technology to allow for devices and systems to be controlled automatically. If we're all going to be living at home, we want to be in a smart house, and these are some of the attributes of the smart house. And health informatics, most of us are in clinical areas where health informatics are a major way of the future. Australia has just had a major health and hospital reform report, and the only part it talks about in relation to technology, nothing to do with ageing, is e-technology. So hopefully we'll get with it. The internet or broadband technology at the University of Melbourne, we have an Institute for Broadband-Enabled Society, which has, to its credit, initiated all these interdisciplinary grants to work with people out of social work and a range of disciplines on ameliorating social isolation by use of the broadband, and again, looking at GPS technologies. But again, the most popular uses of computers, as we've heard here by older adults, include communicating with family and friends, seeking information via the internet, improving work productivity, entertainment, and maintaining functional independence. Personal response systems, we're all aware of those. I think they've been around aid services for some time. And automated tracking systems. Again, there are some ethical issues about trackers and sensors, but I won't raise those now. I've also included here biotechnology and gene therapy, because these days you can pay $1,000 and get your genetic makeup. Now, that may give you more information than you want, but stem cell research and different sorts of interventions and preventions using stem cell technologies are again part of the future. Now, Walmsley and Warren from Sheffield talk about first, second and third generation technology developments. Simple systems, more integrated systems, and then more sophisticated. And we've seen all of those so far, and I'm not going to dwell on that. And again, in the Health and Hospital Reform Commission report, we are seen to be on this trajectory towards more personalised health care. But presently, our health system is down in the corner, healthcare today, and we're trending up to personalised health care, and these are some of the aspects of that. Now, there's lots of fields involved. When I originally did this slide, social work is nowhere to be seen, and I still would ask perhaps, where is social work in relation to the technology revolution? I'm learning a lot from engineers and information science people I'm working with now at Melbourne University, but I didn't initially put social work on this list, but it should be there, shouldn't it? There are some problems, and I've been to plenty of sessions on social and ethical issues with new technology relating to access, performance, abandonment, and we heard about those from Mirella, availability of training opportunities, psychological issues. There is the potential to increase interconnectivity, to compensate for impairment, to facilitate engagement and empowerment, but there's also concern about privacy and confidentiality, the vulnerability to fraud, the cost and access, the high-tech substituting for high-touch, and it could contribute to social exclusion as well as inclusion, and whether the aged will be able to access the top-range models. I've got two more slides. Technological innovation, I think it is a situation of cultural lag. Branko Keller, who's a prominent Australian engineer in the telehealth area, recently publicly bemoaned the lack of readiness in Australia to take up and promote new technological innovation. His frustration had been such that he found he was far more able to market his telemed system in the United Kingdom, where the government policy and incentives were such that his system could be easily trialled. Though Australia has recently undertaken a major review of its health system and released a new report targeting e-health reform as a major plank for needed change, it still lags behind other parts of the world in developing the policy and program infrastructure to accelerate technological developments that are responsive to new demands of an ageing population. And many other countries are still in a situation of cultural lag with limited ad hoc developments of first-generation programs. There is a disconnect, I think, between the development of new technologies, their trialling and widespread utilisation. We lack application research in Australia. There's a lack of appropriate national public policies and the infrastructure for translational research. and consumers have limited knowledge and lack of opportunities for involvement in new developments. Thank you.